So cancer care is a little bit different because, and it's something that I'm less familiar with because I'm not an oncologist myself. I'm a general internist. But from knowledge of the literature, the way that disparities are manifest in the actual cancer care is often by not following the standard of care that is provided to patients. I'll give you an example. And again, culture gets in the way, social determinants. So a lot of the same themes get in the way. There is literature on this from my colleagues about a myth that exists out there in communities of color about lung cancer. And the myth proposes that if someone has lung cancer and they go to lung cancer surgery, that actually exposing the lung cancer to the air causes its dissemination, potentially hematologic dissemination through the bloodstream, or it's not known in the myth whether it's air, he's exposing it to the air and then breathing in the cancer and that disseminates it. As a result, patients have refused treatment for lung cancer surgery, and that's been recognized as a problem and something that many of my colleagues have been trying to dispel. And for example, I have one colleague in radiation oncology who's designed a video or is designing a video to actually photograph what happens when you have lung cancer cells in the lab and expose them to air. They essentially disintegrate. And so he wants to use that to combat the misinformation that's out there. Even if patients want the standard of care, as you might imagine, because of the social determinants of care, of health, sometimes they don't undergo the complete treatment because of barriers such as caregivers. So communities of color are less likely to have caregivers because everyone at their household is often working 2 and 3 jobs, and it's very difficult for them to take time off. They often have jobs that don't have paid time off. And so losing time off from work means not getting paid and perhaps, difficult choices of not being able to afford basic things such as food and utilities. So I'm still haunted by a quote of a patient who didn't want to burden his caregiver and said to me something along the lines of they'd rather die of metastatic brain cancer than burden their child with additional trips to the hospital. So caregiver burden. We talked about transportation already and how difficult it is for those communities. All of these barriers lead to communities of color sometimes not accessing the care they need. And like we talked about, access is about half of, what comprises disparities. And so it's very similar, the themes, even though I'm not an oncologist. From my collaborations with oncologists and the literature, I see the same themes that we face when looking at disparities in clinical trial enrollment.